This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Ebal M is a combination medication that includes Ebastine, an H1 receptor blocker, and Montelukast, a leukotriene receptor antagonist. It is specifically designed to manage seasonal allergic rhinitis, a common allergic condition triggered by allergens such as pollen, dust, and mold. The medication helps alleviate symptoms like nasal congestion, sneezing, and itchy eyes, making it an effective choice for individuals suffering from allergies. Indications and uses. This medication is primarily indicated for the management of seasonal allergic rhinitis, which can significantly impair quality of life due to its effects on daily activities and sleep. It is suitable for use in both adults and adolescents over the age of 15, providing relief from symptoms that can occur seasonally or year-round. How it works. The combination of Ebastine and Montelukast works synergistically to control and prevent the symptoms associated with allergic rhinitis. Ebastine reduces nasal congestion and sneezing by blocking the release of histamines, while Montelukast alleviates inflammation and swelling in the airways by inhibiting leukotrienes. Together, they effectively mitigate the unpleasant symptoms associated with allergies. Directions for use. Take the medication as prescribed by your physician, swallowing the tablet with a full glass of water without crushing or chewing it. The correct dosage and duration of therapy will be determined by your healthcare provider based on your individual health needs, age, and the severity of your condition. It is crucial to continue taking the medication for the entire prescribed duration, even if symptoms improve. Possible side effects. Common side effects may include headache, dry mouth, stomach pain, nausea, vomiting, and upper respiratory infections. If any of these effects worsen or you experience unusual mood or behavioral changes, consult your healthcare provider promptly. Precautions and warnings. Before starting treatment, inform your doctor if you have any existing health conditions, particularly asthma or renal and liver issues. The medication should be used with caution in pregnant or breastfeeding women, and it is advised to avoid driving or operating heavy machinery if you experience drowsiness or dizziness while taking it. FAQs. 1. How long should I take this medication? Take it as long as prescribed by your doctor, typically for a duration of about 14 days. 2. Can it be used for asthma? It may help manage asthma symptoms, but consult your doctor first. 3. How long before I notice effects? Effects may be felt within 3 to 5 hours, but full results can take 2 to 4 weeks. 4. What should I do if I miss a dose? Take it as soon as you remember, but skip it if it's near the next dose time. 5. Can it cause side effects? Yes, common side effects include dizziness, drowsiness, and dry mouth. Thank you for watching. We hope this video provided valuable insights into managing allergic rhinitis effectively. If you have any questions or suggestions, please leave a comment below, and don't forget to subscribe for more informative content.